Hello all, this is Dr. Dheeraj Masapu and welcome to my channel. And we have Dr. Nitin Manohar, who actually has worked as a chief of neuro anesthesia and he has worked in corporate hospital for a long period of time. So we are going to ask him the ways to succeed in a corporate hospital. I think you're ready with me. Nitin, are you ready?
Yes.
Yes! Yeah. So Nitin, being a neuroanesthesiologist, you're a super specialty anesthesiologist. So to succeed in a corporate hospital, so what do you think is actually required? A degree or a skill or a number of years of experience or understanding the politics which are running in the corporate hospital or understanding the management, understanding what is that actually required, because many of the people are interested to know what actually is required to succeed in a corporate hospital.
So I think after you finish your degree, whatever it is, your MD or DM or whatever, you need to decide whether you want to go into an institute-based practice or into a corporate hospital-based practice. If you want to go into a corporate hospital-based practice, your skill set should be very high. That is a primary requirement that I see that you should possess, because you can go and get a job with a DM or with a fellowship that you're a skilled person in a particular branch, but when you get there, the reality will be very challenging. So when I entered a corporate hospital, the challenge was that you need to prove yourself. You need to prove what different you are from the other people and what different skill set you bring to that hospital. So that was the real challenge for me when I started working in a corporate hospital. The surgeons will be highly demanding, the cases will be highly outcome driven, and your skill set and your training should be very good in terms of quality patient outcome. So your skill set is very important, I think.
So what I was trying to tell is the skill set is very important. So from anesthesiologist perspective, what do you actually mean by a skill set? For example, neuroanesthesiologist, a cardiac anesthesiologist, or a general anesthesia person.
So when I did neuroanesthesia DM, so probably the first 1 year went away with getting used to the system, like what I was doing and where I was in the institute. So, and then I started realizing that okay, now I'm into my mid phase of my DM, and I should really possess some skills and try to work on my skills so that I can get into good hospital and I can give output to the patients and to the hospital. So skill set in terms of specific skill set. So like in neuroanesthesia, I was keenly interested in neuromonitoring, and I think neuromonitoring in neurosurgical patients plays a very important role. So I kind of trained in that, read about that, worked on that, attended multiple workshops, and then started building skills on that. So if you ask me for a neuroanesthetist who's going to be trained in neuroanesthesia and going into the corporate hospital, then you need to be trained in specific skill sets like neuromonitoring and I think neurocritical care. These are the two things that really make you stand apart from the other people, because there are a lot of other people who can do general anesthesia, who can also manage neurosurgical patients. There are normally other critical care specialists who can manage neurosurgical critical care patients. So, but you need to go with specific skill sets. So, unless you train yourself in that way, your survival becomes very difficult, because you might get a job, but to keep that job is going to be really difficult unless you prove it to the system, to the surgeons, to the corporate hospital that you are really giving an extra bit apart from your routine work.
So you mean to say that you need to show that you're adding extra value to the system?
Exactly. I think extra value comes in terms of extra effort. So cardiac anesthesiologist who can do TE is very well taken by any team. So similarly, a neuroanesthesiologist who can do neuromonitoring, who can do neurocritical care work. These are very specific skills that make you more employable and more sustainable in an environment in any corporate hospital, because corporate hospital is a very competitive world. So I can tell you that if you join a corporate hospital, right from the day one, you'll be judged. and people will be looking at you in all kinds of ways, that what extra benefit or what extra value you are bringing to the institute or to the religion.
So my question is basically, see, our anesthesiologist joined a corporate hospital, so a general anesthesiologist. So how can he become valuable in the system?
So, if you have passed your general anesthesia, you have done all your basic training, and then you join a corporate hospital, the hospital will look at specific skills. So, if you can do regional anesthesia, if you can do blocks, if you can use ultrasound guided blocks, if you can do specific skills like obstetric anesthesia, labor anesthesia, if you're well versed with it, if you can manage neurosurgical patients with neuromonitoring, if you can do cardiac anesthesia with cardiac skills like T and the other cardiac anesthesia work that comes with cardiac anesthesia. So, every institute I think is looking now at specifically trained people who can deal with these specific set of patients in a very in a very skilled way. So if you have to survive the market, you have to upskill yourself. So upskilling is a very important thing that you need to focus in your training.
So you mean to say that it's a constant learning process that should go on?
Oh, definitely. I think as anesthesiologists, I think we're blessed to be in a branch that is constantly evolving, and learning process is a process that should go on, and you should learn new skills. Learning is definitely going to be, it should be a very important part of your journey.
So in a corporate hospital, we hear that there are a lot of politics going on, because some people say that some people pull you down, or some people try to prove their importance by pull you down. So is it real, or it's
Oh no, it is definitely real. Like everywhere in the world, like if you join a hospital, corporate hospital, and you get into a job which defines, like if you get into like I'm a neuroanesthetist. When I got into corporate hospital like a neuroanesthetist, then you need to give a certain output. You need to give some special skills. You need to give some special things to the patient by doing going an extra mile. So I used to do neurophysiological monitoring, and this used to help the surgeons in their neurosurgical procedures, and the neurosurgeries could be made safer. And so these kind of specific skill sets you need to learn. So whenever you're training in your own specialty, whatever the specialty is, you should focus on key skills which will make the patient outcomes better, and by this way you can survive in the corporate world. Otherwise there will be enough people who will pull you down. Even every other day you get asked this question, okay, what different being a neuroanesthetist? So even I can do neuroanesthesia, I can intubate a patient, I can put lines. What different do you do? So you need to prove it every day in your day-to-day work, that you are doing something different than them, going an extra mile, understanding the pathology, understanding the physiology, and contributing to the patient's outcome. So it makes it more challenging.
So what Nitin is trying to tell is, on a daily basis or on a monthly basis, you need to prove that you're valuable for the system. And so the next question is, most of our subscribers are like first year MBBS, first year MD, or MBBS pass out guys. So between MD and DNB, like MD and DNB who join corporate hospitals, who would have an advantage?
So I think it doesn't make a difference if you are an MD or a DNB, as long as training is strong. So your training needs to be really strong. So gone are those days where they used to consider DNB as inferior, or people used to not pass DNBs. Now the DNB pass percentage is also improved quite a bit. So if given, I did an MD, but if I would have been given a choice then, and I would have not given the entrance exam and struggled for the entrance exam, I would have taken a DNB and learned the same skills in the same the way the other people are managing. And so MD or DNB doesn't matter unless your skill set is good. So the skill set is what is important, and the degree doesn't define it. Obviously defines when you enter a system, you're taken as an MD or a DNB, but ultimately what makes you survive through the system is your own skill set. So it doesn't make any difference in today's world, I can tell you. DNB or MD, anything is good from a good institute, and a good training is what is required, and you need to have specific skill sets.
So last question is that, like, should everyone do a DM like you did, or should I settle with an MD with a general experience? Should I basically what I'm asking is, should I specialize in one zone, or should I settle in a MD anesthesia, which would be more safer in future, I think?
I think you should define yourself as to where you're going to work. So if you are targeting to work in metro cities, you need to specialize. I think the gone is the days where general anesthetists are being taken in as specific skilled workers in corporate hospitals and in metro cities. So if you're looking for metros, definitely you need to specialize. If you're looking at the peripheries of the second tier cities, general anesthesia still will suffice, but still again you have to be upskilled, and you have to be standing apart from the market. So you need to have specific skills like ability to give regional anesthesia, ability to do complicated work like neurosurgical procedures and complex GI work and complex obstetric work. So these kind of skills you need to build so that you can survive.
So what about the academics and research that happens there?
Oh, this is a very good question, Dheeraj, because previously corporate hospitals used to be taught as non-academic, and people who are not interested in research and only doing clinical work. It is not the situation now. I think now is the time that corporate hospitals are looking at specific people who can do academic work, who can train people, who can build a system, who can have trainees, who can do research also. And I've been blessed to be in a hospital where I used to do research, I used to publish, and the publications used to be rewarded, and in various ways. So so even in an interview, when you go to a corporate hospital, if you have publications, if you have done good research and academic work, it stands out from the other people. So you will definitely have a chance to get into the job and also to sustain the job. So gone are those days where corporate hospitals were used to be considered as non-academic and non-research oriented. So it's not the same. Person who comes with it only MD is definitely going to be underpaid, and a DM is going to be paid well. But again, to maintain that pay and to maintain that salary and to grow from there is depending on the person. So simply, if I tell you, if you CP specialize, your ability to survive, and people in the corporate hospital are also looking at in a different way now. So every team in a corporate hospital is outcome driven. I can tell you this, that if there is an orthopedic team or a trauma team, they will look at people who can do regional anesthesia. If there is a neurosurgical team, they will look at people who are trained in neuro anesthesia. If there is a cardiac team, they will look at cardiac anesthesia trained people. If there is a obstetric hospital which does a lot of obstetrics, they will look at people who have done fellowships in obstetrics. So it definitely adds to your value and your CV to get a job, to survive in the hospital. Also, it definitely helps you a lot.
So very tricky question. So basically, see, MD anesthesia and DNB anesthesia pass outs are getting around 90,000 to 1 lakh in India, and DMs are getting around 1.8 to 2 lakhs in India. So do you think DM should get double of MD, or what is your opinion about this?
Very nice question, but see, ultimately your primary salary will not define the salary that you will eventually get. I think even if you join at a lower salary, eventually the team will see you as an asset, and when they start seeing you as an asset, your salary can build. So a DM, even if he starts at 1.8 to 2 lakhs, can go up to 3 to 3.5 lakhs easily in a year. I've seen that happening with myself and with many other colleagues. And likewise, for an MD, it is really difficult to climb up the ranks. So probably a DM will give you a parallel entry into the top tier. So I would recommend doing some kind of specialty training, either a fellowship or a DM, and then entering into the system. Because if you enter as an MD, though you have the skills, though you learn the tricks of the game and you have the skills, you train, but eventually the person who is having a degree will be more valued, and degrees are valued nowadays, even in the corporate hospital. So it is worthwhile doing degrees which can fetch you good jobs and good pay also.
So thank you very much, Nitin. And this is about corporate hospitals and how the politics go on and how to succeed in corporate hospitals. Thank you for very valuable input that you have given. And there are many audience who will get benefited by this information that you have given. So any final conclusion tips you want to give to the audience?
Nothing. I think, after you do any course, either MD or DM, you have two routes. You either go into an institute-based practice or you go into an corporate-based practice. So build your skill set based on that. So if you are going into an institute-based practice, try to do a lot of academic work, research work, publications, which can get you, through the interviews, and this is what is going to make you get jobs in academic institutions. Likewise, in the corporate hospitals, you need to have specific skill sets. You need to upskill yourself. You need to, you need to give output. So you need to have these additional skill sets in various specialties in anesthesia if you are going to survive the market. So getting a job is a different thing in the corporate hospital, but surviving the job is really difficult. And believe me, it is not easy in the corporate hospital. You must have
it's not going to be easy. You have to survive the market. You have to prove that you are one of the best.
Unless you are going to prove that you are the best and you're valued and you're an asset to the team, you're not going to be kept for long. So you need to keep learning. You need to keep evolving. This is a constant journey that everyone goes through. So there are two different routes, and choose whatever suits you, but prepare yourself at your MD level. So your journey begins in the first year MD itself, as to whether you're going to join an institute or a corporate kind of a hospital, and have it in mind and start thinking about the skills that you need to possess, and you need to hone, and you need to learn so that you can survive in the market. So likewise, in the institute, you need to probably focus more on academics, more on research, though both are important in both ways. Like academics and research is also given importance in corporate, but upskilling is what is more important.
Thank you very much, Nitin. And I think hope audience would love this video. And thank you very much for following the video till the end. As usual, Dr. Dheeraj Masapu logging off. Roger that.